What is high blood pressure? Have you ever wondered what high blood pressure really means? High blood pressure, also known as hypertension, is a condition where the force of blood against the walls of your arteries is consistently too high. This means your heart has to work harder to pump blood throughout your body. Blood pressure is measured using two numbers: the systolic pressure, which is the force when your heart beats, and the diastolic pressure, which is the force when your heart is at rest between beats. When these numbers are elevated over time, it can lead to damage in your arteries and organs, including your heart, brain, kidneys, and eyes. Most people do not notice any symptoms with high blood pressure, which is why it is often referred to as a silent killer. However, if blood pressure reaches very high levels, typically 180/120 millimeters of mercury or higher, it can cause severe headaches, chest pain, dizziness, nosebleeds, and vision changes. This situation requires immediate medical attention. There are two main types of high blood pressure. The first is primary hypertension, which develops gradually over time without a single identifiable cause. Factors like genetics, lifestyle, and diet can influence this type. The second is secondary hypertension, which results from an identifiable cause such as kidney disease, certain medications, or hormonal disorders. When it comes to managing high blood pressure, diet plays a vital role. Diets high in salt, saturated fats, and trans fats can increase the risk of hypertension. On the other hand, diets rich in fruits, vegetables, whole grains, and healthy fats can support heart health and help regulate blood pressure. The ketogenic diet, which is low in carbohydrates and higher in healthy fats, has gained attention for its potential benefits for specific conditions, including heart disease. When managed properly, this diet may help reduce risk factors like obesity and insulin resistance that contribute to high blood pressure. To manage high blood pressure through diet, consider these practical approaches. First, reduce your sodium intake to lower blood pressure and decrease strain on your arteries. Next, increase your consumption of potassium-rich foods like leafy greens, avocados, and nuts, which help balance sodium levels. Emphasizing whole and processed foods can provide antioxidants and anti-inflammatory compounds that support vascular health. Lastly, limit processed foods, sugary drinks, and excessive alcohol, as these can worsen blood pressure. High blood pressure is common but often symptomless, increasing the risk of serious cardiovascular problems. Adopting a diet focused on healing and nourishing foods can be a powerful tool in managing and preventing hypertension while supporting overall heart and artery health. Regular monitoring of blood pressure and consulting with healthcare providers is essential for effective management.